Here is your station.
Okay, I'm ready.
All right. So if you have read and understood, considering it critical care scenario, please tell me, how would you manage this patient now?
As this patient is a case of RTA, I will manage the patient according to the ATLS protocol, Advanced Trauma Life
Okay.
Support.
Yes.
To include, at first, I will protect myself wearing gloves and face mask and head cover and gown. Also, then I will start primary survey that include airway and cervical spine protection. As the patient Glasgow Coma scale is 8, I will intubate the patient.
Very good.
And
Yes.
I will protect his cervical spine that include putting a cervical collar and putting a sandbag. Also restrict his head with a tape.
Wonderful. Yes.
Then I will check to the airway. Also, I will check his trachea if it is deviated or not. Also, B, I will check his breathing, chest movement. Also, I will rule out the pneumothorax by percussion and auscultation. Also, check his oxygen saturation. Also, I will put uh, auscultate his heart also to rule out any muffled heart sound.
All
Then
right.
yeah,
Please tell
and
me, yes, what measures would you take to make sure patient does not goes into cerebral edema? Because
what
you're
measure?
going to, yes, what measures would you take to prevent patient going into cerebral edema? You have
Yeah,
intubated, yes. What else
yeah.
would you do?
To protect his brain, I should prevent hypoxia and hypotension. This is
Yes,
the most important in
and
head trauma.
and
The other, also, I will maybe elevate his head 30 degree.
definitely once you're intubating,
And
you will be
yeah,
elevating
and
head.
also sedation helping to prevent agitation, sedation and intubation, elective intubation to prevent the increased intracranial pressure.
You're not understanding. You'll give diuretics. Which diuretic would you give?
Yeah, I will give one medication for the brain. It's mannitol. It's
Mannitol. And then you'll restrict
hyperosmolar.
fluid. You'll restrict fluid in order to prevent cerebral edema. And what else would you do?
Restrict. Also, I will monitor his intracranial pressure.
Yes. How would you measure the intracranial pressure?
Several methods
Yes.
include epidural uh, probe or
So please
intracranial pressure.
classify
Yeah.
them into invasive and non-invasive, and then tell me, please.
Actually,
Okay.
I remember
What should,
it without this
yes,
classification.
next time you tell me that. Please tell me
All
what
of them
should
is
be.
I think all of them is invasive except lumbar puncture.
No,
This
non-invasively transcranial Doppler that can measure MCA
okay.
velocity, and that can be done without. Yes. All
Okay.
right. What should be the normal intracranial pressure?
Normal intracranial pressure is between 7 and 15 millimeter
Millimeter of mercury. Right.
mercury.
This should be normal. All right. Would you or would you not consider doing lumbar puncture in this particular patient?
In head trauma, we should
In this one.
it's contraindication to do
Why?
lumbar puncture
Why?
because the patient high risk for bleeding and brain herniation
Herniation and coning.
and coning.
Please tell me what is Cushing reflex?
Cushing reflex is bradycardia, hypertension, and this irregular breathing, respiratory rate, irregular respiration.
Okay. What includes in Cushing triad?
What include? It
Yes.
include the respiratory rate, blood pressure, and
what I want you to realize that you're mixing Cushing triad and Cushing reflex. Right. Okay. Please tell me, what is lucid interval?
Okay, lucid interval is interval between two interval of loss of consciousness. It is interval of improving of temporary improving in the consciousness between two episode of loss of consciousness.
Okay. Please tell me the pathophysiology behind Monroe-Kelly hypothesis.
Monroe-Kelly hypothesis is the basic principle of this hypothesis is consider the brain or cranium is a fixed box and contain a three component brain, blood, and CSF.
Good.
Any change in any of this component lead to
Okay.
decrease the other volume of others until a specific pressure, which is 25 millimercury. After
Yes.
that, there is a dysregulation of this hypothesis. This lead to increase the blood pressure and decrease the cerebral perfusion pressure.
Okay, please tell me, in case of a head trauma, when would you decide CT scan should be done? In other words, what are the indications for doing CT scan in head trauma patient?
CT scan indication Glasgow coma scale less than 13
Yes,
or decrease the Glasgow coma scale from 15 after 2 hours from presentation
yes,
or depression fracture of the skull or sign of base skull fracture, which is battle sign or broken eyes or CSF leak from rhinorrhea or from the otorrhea.
yes,
Also, other indication if the patient is above 65 or
yes,
the patient have a bleeding disorder,
or
also
head twice
vomiting more than
vomiting.
2 times, or any sign of increase of blood pressure or neurological deficit in any ways.
All right, good. Okay, please tell me. Right, if you could have a look at this image and help me to read that.
At first, I will check the patient name and age and medical record number
Very
and
good.
date and time of this image.
Image.
This image is a CT scan for the brain
Yes. Sure.
showing a right biconvex mass in the biconvex mass, uh, which with midline shift and compression of the ventricle.
Right, very good. Okay, right. I want you to tell me, how would you tell if your patient is suffering from raised intracranial pressure?
What's the question? Sorry.
Yes, what are the signs and symptoms when you'll realize that your patient is suffering from
Yeah.
increased intracranial pressure?
Nausea and vomiting, convulsion, also papilledema, also
Papilledema. Yes.
papilledema, and the Cushing triad,
All
which
right.
is increased blood pressure, bradycardia, and irregular breathing rate.
Okay. Right. Bella's gone. Right. Right. Who should you involve in the management of this patient with head trauma?
I will manage ITU, registrar. Also, I will general surgery and the neurosurgery and anesthesia,
Right.
and even the OR room nurse.
Okay. Good. Thank you.